Welcome back to the channel. This is Health, and today's video covers one of the most important and eye-opening updates in the U.S. healthcare system for 2025. Before we begin, let me ask you something. What if I told you that the way Americans receive healthcare, pay for treatment, and access essential services is about to change in a way we haven't seen in years? What if this year brings a shift that could finally make healthcare more accessible, more affordable, and more transparent? If that caught your attention, stay with me, because this latest government announcement is something every American needs to understand. The update announced today has already started making waves across hospitals, insurance companies, and policy circles. According to officials, this change is not just another small policy adjustment. It is described as a transformational step designed to make the healthcare system work better for everyday people. And as we break this down, you're going to see exactly why experts are calling this one of the biggest health updates of the decade. Let's begin with what this new change means for affordability. For years, Americans have been hit with rising medical bills, unpredictable emergency room costs, and insurance premiums that seem to increase every single year. The government says it has heard these concerns loud and clear, which is why this new update introduces a national effort to cap costs on essential services. This includes preventive checkups, emergency procedures, chronic disease treatments, and several categories of life-saving medications that millions of patients rely on every day. What does a cost cap mean for an average person? Imagine going to the hospital for an emergency and actually knowing the maximum amount you'll be billed for. Imagine buying a medication you use every month and paying the same low, stable price instead of seeing it jump unexpectedly. This new system is designed to bring predictability and fairness back into healthcare pricing, something Americans have been demanding for years. The government has also made it clear that insurance companies will be monitored more strictly to ensure they follow these new pricing rules. Another major part of this update is accessibility. In many areas of the U.S., especially rural communities, getting timely medical care has become extremely difficult. Long travel distances, lack of specialists, and overloaded hospitals have created a situation where patients simply do not get the care they need. To solve this, the government has announced a massive investment in expanding telehealth services, growing the healthcare workforce, and building more community-level medical centers. Telehealth, which became popular during the pandemic, is now being positioned as a permanent pillar of the U.S. healthcare system. Patients will have easier access to virtual doctors, remote monitoring, and even online prescription management. For many people, especially seniors, disabled individuals, and those living far from major cities, it means fewer delays, less travel, and more consistent care. Alongside this, new training programs will be launched to bring more nurses, physicians, and technicians into the system, aiming to reduce wait times and improve the quality of treatment nationwide. Now, let's talk about transparency, something that has been missing for a very long time. One of the biggest frustrations patients have shared is the lack of clear information about costs. People often walk into a clinic or hospital without knowing what their final bill will look like. This update introduces new rules requiring hospitals and insurance providers to clearly display the cost of treatments, diagnostic tests, and procedures up front. This means you'll know exactly what you're paying for before you even receive the service. No more guessing. No more hidden charges. No more shocks when the bill arrives. Another highly talked about part of the announcement is the focus on preventive healthcare. Instead of waiting for people to get seriously sick and then spending massive amounts on treatment. The government wants to push the system toward early detection and prevention. Under the new rules, many preventive services will be offered at little to no cost for millions of Americans. These services include screenings for major diseases, annual wellness checkups, vaccinations, nutritional counseling, and mental health assessments. The idea is simple: catch problems early, treat them early, and keep people healthier for longer. This not only saves lives, but also reduces the overall cost burden on the healthcare system. Speaking of mental health, the announcement puts strong emphasis on improving access to mental health services. The government acknowledged that mental health has long been underfunded and underserved in America. To address this, new funding is being directed toward mental health providers, crisis support teams, teletherapy platforms, and community-based counseling programs. Another element in the announcement is support for seniors and people with disabilities. The government is introducing expanded home-based care options, improved Medicare benefits, and additional resources for caregivers. This includes financial support for families who care for elderly or disabled loved ones at home. The goal is to help people stay in their homes longer, receive better care, and avoid unnecessary long-term facility costs. There is also a major focus on prescription drug pricing. For years, high medication costs have been one of the biggest struggles for American families. Under the new update, the government will negotiate prices on several high-cost drugs and limit how much pharmaceutical companies can increase prices annually. These changes are expected to save patients hundreds, or in some cases, thousands of dollars each year. Now, with all these changes, the big question is, how quickly will people start seeing the impact? Government officials say some updates will roll out immediately, such as cost, transparency, and expanded telehealth options. Other changes, like building new medical centers and upgrading technology systems, will take months or even years to fully implement. But the overall direction is clear. A country is moving toward a healthcare system that focuses on affordability, prevention, transparency, and patient-centered care. What does this mean for you personally? It means more predictable medical bills. It means more accessible doctors and services. It means better coverage options from your insurance provider. It means lower medication costs. And most importantly, it means a healthcare system that feels less confusing, less expensive, and more supportive. Before we wrap up, I want to highlight one more important thing. This update is not just about policy, it's about people. Behind every change are millions of families who struggle with medical costs, seniors who need better care, patients battling chronic diseases, and young people trying to stay healthy. This announcement is meant to address real challenges that affect real lives every day. And with that, we come to the end of today's video. I hope this deep dive helped you understand the full impact of the latest U.S. health update for 2025. If you found this information valuable and want to stay updated with everything happening in the healthcare world, make sure you subscribe to Health. Hit the like button and turn on notifications so you never miss our future videos. Thank you for watching. Take care of your health, and I'll see you in the next one.